If you have pain and swelling, Tylenol doesn't bring swelling down. Is that true?
It's not an anti-inflammatory.
So if you have swelling, that's where you mentioned non-steroid anti-inflammatories like Motrin and Aleve.
Yeah, I'm a believer in non-steroidals for different types of joint syndromes, even early herniations. It's been helpful for that. But Tylenol is still not a bad pain medication.
For pure pain.
For pure pain.
But if you have swelling, especially in the initial phases, aspirin, which has been used for many years.
Right.
Aleve, Motrin, Advil, it's the same thing.
Exactly.
Okay, and of course you always make sure that there's no contraindication because every drug has a good point and has a bad point.
I mean, we're all medications have good and bad points. We explain to anyone who's on long-term non-steroidals, they need to bring a hemocold sample either to us or their primary care physician. We know that certain people that have cardiac problems are more susceptible, especially to naproxen, the Celebrexes. Certain things like liver function studies have to be tested on a yearly basis. So they're not without risk, but I think the risks are very well managed.
In other words, a doctor shouldn't just write a prescription or tell you to take something. There should be a plan to follow anything you use on a long-term basis.
Yes. I think the problem that we make in this country is we have this knee-jerk response to put people on pain medications before we actually have a diagnosis. And we can't help it. We're physicians. People come in, we hate to see them in pain. We don't want them to see them hurting. But I think sometimes we have to think a little of what type of medications we're putting on before we make that diagnosis. We have to be careful, because then you'll get in trouble with these patients on long-term narcotics or even long-term non-steroidals. That could cause problems because we haven't made the accurate diagnosis, because in the old day pain was not considered a real problem. Now with fellowships in pain management and the millions of people that are in pain, it's actually its own specialty with its own board.